the pandemic has taught a lot of lessons to each and every industries, but every crisis gives the opportunities, and all the corporates especially, they jump to help all the government of India for whether it is supply chain disruptions or access to the commodities or oxygen and so many things. But still, I think post-pandemic, a lot of changes has been happened, especially the leveraging the technology. In the world, there are 6 billion smartphones, and there are only 2 billion toilets. So every poor people wants to be part of that aspiration, smartphone, technology, internet, and that's where this eminent panelist is going to discuss how the internet is going to be leveraged to improve the access of health or technology or any public health information. Especially the government of India has been creating a lot of enabling policies for the corporates. I'm sure panelists will discuss if there is any challenges, health and wellness center and so many things, where definitely they are welcoming with the heavy heart in terms of how they can support to improve the health services to the poorest of the people. Because right now, I'm working with the PATH. PATH is the international non-profit organization working in more than 70 countries. I'm leading $38 million portfolio in the South Asia. And our vision and mission is to improve the access of health equity through innovation and partnership. And that's where we are talking about the innovations today. So I'll start with, with our panelists in terms of how they are contributing. First, rapid fire in terms of how they are contributing in their organization with one story or one innovation quickly, and then we can start with, I'll start with Dr. Prabhat, you, so that briefly about your organization and one innovation and how in the pandemic times any significant change that you made. Okay.
So I represent a company called Boehringer Ingelheim. It's a German-based pharmaceutical 135-year-old privately owned company. So from a CSR perspective, I'll focus because in company after and during COVID, there has been a lot of transformation that has happened. And the biggest transformation that has happened is in terms of how we reached out to patients, whether it is delivery of drug or it is, especially reminding them about, whether it's therapy. So a lot of things, it was there before also in terms of app and all, but I think it became a necessity during and after COVID, right? So when you talk about innovation, it's not only the drug, what we innovate as an innovator company, but also in terms of we are delivering healthcare down to community. I think there has been a lot of innovation. What was happening in digital, we have kind of leveraged that because you don't need to innovate as every individual partner. There is enough innovations happening. For example, there are companies, for example, Cure AI, a lot of you have heard about, how they are using artificial intelligence for diagnosis. There are some interesting startups who have been doing drug delivery in terms of keeping it in a small packet so that you don't forget कि सुबह में मेरे को 3 दवा लेनी है, दोपहर में 2 लेनी है, शाम को 2 लेनी है. They have come up with a very nice packaging where you send your prescription, they will pack it, and then you just have to take that packet and consume. So not essential that you innovate. There are enough innovations where you support. Yep. That is one. The one thing what I would like to share, which we partnered with IIT Kanpur recently, which was helping IIT Kanpur, or IIT Kanpur rather, was working on a device which was handheld device for TB diagnosis. And we had a mission up to 2025. We want to eliminate TB, but still bringing people from rural area to a health post is a big challenge, as we know. So IIT wanted to work on a device which is handheld X-ray machine, very innovative, and you will be happy now this device has taken a shape. So from our CSR we have supported them, and there are other partners, ICMR, there are other partners, but very soon we will see a handheld X-ray machine which will go from hospital to the doorstep of the community. And I think as CSR we have to keep a close eye on the enormous innovation which is happening around. We need not to innovate everything at our own premise, and to partner with right partners to give them that a boost.
So one of the area with the CSR, CSR does generally with the pilot in small geographies. That's where the visibility is also little less. So I will go to the Dr. Vibhav, because Boston Scientific does a lot of scale and they help for other organizations also. How this small scale can be, used for wider visibility, or with a low volume, the cost will be low and it can be used for a wider community. With your organization experience or any suggestion, because we have to see not only from organization point of view, but what audience want to hear also. So that's
Sure. No, thank you. Thanks IHW Kamal for this opportunity. Very thrilled to join this very specific, platform, CSR Health. How to connect CSR with the innovation. That's a theme, and very. It intrigued me when I thought about it. But specifically to answer to you, sir, I think CSR, when it was made statutory for the organizations in the country, I think everybody was thinking, how do we go about it? And I have seen this evolving, when it was first made statutory till today. People have found out various avenues to contribute to their interest areas where they want to contribute to CSR, but also to the calling of the country as well, right? When Prime Minister talked about let's go behind preventive health, I think a lot of corporates came in and invested into health and wellness center upgrade basically, right? Primary health center to health and wellness center. And I think if we talk about how this pilot into a small geography helps, in my opinion, you are trying to create a model. I think that model, if you are able to create successfully, then replicating that model becomes very easier because then you have initiated it. Yeah. And I think that's where, in my opinion, if you are able to deliver a workable model, whether it's a workable health and wellness center, whether it's a workable any pilot that you want to do, I think then scaling it up becomes easier for either other companies through their CSR or even commercially for that matter. Yeah. Right? There are a lot of companies who upgraded PHC to health and wellness center as a commercial model also. So therefore, in my opinion, the small you go as a pilot and you create a successful pilot, mimicking it, replicating it becomes easier because you know the ecosystem which will be around the pilot, you know the stakeholders, and then therefore replication becomes easier. So that's a model I would say would go from a smaller to a scaled up model basically.
Oh, great.
Thank you so much.
Thank you so much. That's helpful. So, Mr. Gopal is, working with the scale. They are working very closely with the Government of India for improved access of that life-saving drugs. And their model is something unique. Maybe it's helpful for the audience because we are discussing of the, informally there. And they have some successful in terms of procurement. Working with the Government of India, it's not easy. Maybe if you can share, if possible, how it will be helpful to others too.
It's a big tricky question, what success you have to share, but before that I would like to extend my thanks to IHW for this invitation and be part of this seminar panelists. Takeda is a Japanese company, a 200 plus years old company. I don't know how many pharmaceutical companies does exist as of now. And the philosophy they have of brighter health for better future. And we have a very strong decision framework, which we call PTRB, which patient. So when we take it, patient has to be the first, followed by trust, reputation, and then the business. So if you are not clear around policy, process, put this framework, take your decision. I think that's the starting point. Now coming back to your specific questions, I'll try to answer in two parts. One from public reimbursement and second from out-of-pocket, because India remains a big out-of-pocket market. We talk a lot about accessibility of affordability. Takeda is among, I don't know how many of you know, Access to Medicine Index. Yeah. So we are part of this. Top 20 companies are measured across the globe in terms of accessibility, availability, affordability of the drugs and entire treatment, and we feature among the top 10 consistently for last few years. And this framework has really helped us. Specifically, two initiatives what we have been doing consistently from a patient perspective. We all understand that big multinational companies, we have a perception they are getting money from top, highly priced. But I can assure you, we have a framework called Patient Assistance Program, not simple standard, leveraging technology, innovation. They are customized financial assessment based models. Completely transparent with complete privacy from a patient perspective through a digital app, through a third party which is reputable. Every patient gets assessment based on their affordability level. The rest payments are taken care by the Takeda. So we're not standardizing everything that everybody who I can afford, I'm getting a subsidy. It's that way. So that's a very, very unique approach. We have improved our complexity, but we have improved our accessibility and affordability. Now coming to the last part of this from a government perspective, outside, it looks like very shabby. It looks like what's there. But what I've seen my experience the last 30 years, Government has so many priorities. Let's understand that. For them, malaria is equally important. They may not have importance for rare diseases. But for me, rare disease is important. Every life does matter. So I'll give you one example. When I was meeting one of the state government officers, they says, from rare diseases, you have 10,000 patients. We are working for tuberculosis of millions of patients. We said, you can make life 100% better for your few hundred patients. At least be role models somewhere. One example. Second, we talk about them. We really help them to build their patient programs, state programs. Believe me, many state program officers does not know how to build a patient program. Money is not the issue. Issue is building the right rationale to demand money from the top senior bureaucrats. I think we have been quite successful in truly partnering. The business may go to competitors also many times, but we become a great technical partner in building their program implementation plan for those specific disease areas. So I think that has been quite successful for us.
Thank you so much. I never heard of this successful model working with the government. Generally it's very challenging, but kudos to your efforts. So Dr. Sachin, I think Sony has just entered into this artificial intelligence and digital. Of course, globally it's there, but as a CSR, you're making entry into the COPD. So maybe a lot of CSR struggle to work with generally the system, lot of approvals and research and pilots, and maybe what kind of challenges you are facing if you want to scale this program across the country. I know you are still in initial stages. Maybe if audience wants to know what are those initial challenges that you are facing right now, how you want to overcome those.
Yeah, definitely. It's a well point. That yes, AI comes with lots of, I would say, solutions or scope for improvement in various sectors, whether banking, hospitality, and healthcare definitely. So healthcare, like being from AI side, even me, my team, we are not the doctors, so we have to reach the doctors, we have to understand them, what is the disease or whatever issues basically are there, or maybe what is the issue faced by the patient and the doctor. And there's a big difference, I would say, between the patient and the doctor, and might be for, let's say, headache, for example, one patient may take 1 minute to explain, might be the second patient may take 3 or 4 minutes, and he may use a different wordings, I would say. But doctor, I think he is the person who listens very carefully and then decides, okay, what is the issue, what is the symptoms, what is the biomarkers he is talking about, and then maybe coming up with some suggestions for the testing or some solutions. So I think AI is trying to bring a bridge between these two parties, and definitely AI cannot replace the doctors, or it is just one of the helping hand to them. So first of all, I think AI is trying to understand, okay, what type of disease is there, what type of issues are faced by the patients or the doctor, or especially what type of diseases or maybe symptoms or biomarkers are there, because it may vary geographically depending on the intensity, depending on the type of the food or the habit that people carry. And that's why we see lots of variety. And I think in that case, that's why sometimes we call the synthetic data, which is like a recently approach, which is also quite burning in the media now. So that is one helping hand, but definitely with healthcare, we have lots of challenges of working on the actual patient data, understanding the actual pain point of the patients.
Yep.
And for that, maybe AI looks very fascinating, but it has to go gradually in a step-by-step, I would say, and it has to follow, I would say, generations or a certain version-wise based on the ROI, based on the interest of the parties or the investors, and it has to go in a section-wise, and it cannot be miracle in a night. But yes, we have to understand more, and definitely AI cannot replace the human intelligence no matter what sector. The AI can be just helping hand for the human intelligence so that humans can do more tasks. Because I think COVID is the one example that we suddenly came to the world and world was not ready for such kind of disease or the challenges. I think that's why all the people, no matter whether somebody for the technical, non-technical, medical, non-medical, I think everybody was trying to contribute in this era of this COVID. So I think that's why the people or the humans are made to do lots of more things. And I think that's the right time to maybe do a good clubbing and do it out here. Thank you.
Thank you so much. Dr. Karthik is most literate amongst ourselves. He has a 4 PhD, 10 startups. I don't know how he manages his time. So let's want to hear from you how you are, going to be vision for helping the CSR or any startup, because the person like you might be more needed in the public health point of view, because you have very diverse expertise in terms of all the startups.
First of all, thank you very much for this opportunity to the IHW and Mr. Kamal, and congratulations to all of you to have been part of this wonderful session since I say afternoon. It's been very engaging and insightful. Yes, so I have a little bit of journey in all of the experience shared by the expert panelists here. I've been working, specifically with banking for almost 15 years. I used to be the head of Standard Chartered Bank's Open Innovation Program. Even during my days at SCB, when we were helping, as we called, the elephant to dance, if the bank could be imagined to be an elephant, to compete and to adapt to the agility of, say, fintechs, and to really create social impact. So I still remember in many of the banking financial services companies I worked, including Dun & Bradstreet, we would always put human-led digital, right? So the human, and more importantly, before the human, the values. Fundamentally, if you take any industry, and since there's so much talk about healthcare in today's event, as a healthcare expert, I can tell you that most of patients want that experience. We talk about the patient-centric journey or the patient experience, the value-based care. But it's not just the value-based care, but it is the values which is driving those humans who are at that point of care at particular point of time. Now, moving on, we heard views of generative AI. I believe that also as one of, I would say, Asia Pacific's expert in the domain of ethical AI, there's a lot of concern to look at generative AI and some of the impact it can have on the job market, or some of the impact it can have in terms of general outlook to the economy, macroeconomic factors. A lot of emphasis is being placed on transparency, privacy, and ethical aspects of artificial intelligence. Now, coming to the specific question, having been in the banking industry, consulting for 15 years, moved to healthcare during the peak of COVID, I would quickly give an anecdote. I'm a little bit of a storyteller. I'll try to conclude this in the next 90 seconds. So when I was caught in the middle of the pandemic, transitioning from Standard Chartered Bank as the head of innovation to a leading healthcare firm in Nashville, sitting in the 10 by 10 feet room of my parents' home, kind of caregiving to my parents, I asked myself, how can I make an impact to the society? And between April and June of 2020, when the entire world was seeing the wave of the pandemic, I realized that social impact or corporate social responsibility is highly underrated or misunderstood in terms of it being something which the corporate has to do. I believe that it has to start with the individual. And if I go back 16, 17 years back to the first consulting company I worked with called Dun & Bradstreet, our sustainability or corporate social responsibility program was called as ISR. It starts with the intent to do at an individual level. And as the famous adage goes, charity begins at home. So what is it which I could do? So quickly rewind to that point of COVID, the Honorable Prime Minister had launched 3 hackathons, which were called as Samadhan. Canadian government launched something called as, COVID hackathon. IBM, SAP, and United Nations came through. And I realized overcoming my own fear of the pandemic, using the skills, expertise to make a difference to the society to combat COVID-19 with technology, Industry 4.0 solutions, led to this whole aspect of, I would say, creating a social impact. Thank you.
Thank you so much. Thank you. Is there any burning questions? Because I just want to, Rajesh, because we work with the non-profit, you are heading one of the major organizations. Any burning questions for the CSR? Because, there is always a silos. CSR does a lot of good work. International profit also a lot of good works. How collaboration is needed? Anything you want to ask, or I'll ask behalf of you? Yeah, please. Give the mic to Rajesh, please.
The point which you really talked about, from pilot to a scale, I think we would like to really hear from really the corporates that any one model that you can really think about how, and that to scale vis-a-vis the government, that's the mandate. Either Agrawal, Gopalji can really talk about.
I just wanted to touch one point, and that came in my mind when you just spoke partnership, collaboration. How many know ABBA card? How many have in this room? Raise your hands. Not even 10%, 15%? Guys, Government of India, Ayushman Bharat has a Ayushman Bharat digital account. The entire technology has been integrated at one platform. If people sitting in this room does not have this card, what we are talking about technology innovation, can we partner, can we scale up this? They are looking how industry, NGOs, corporates can partner and scale this up. We don't need, as in Prabhat, too many innovations, too many startups, different. We can just scale this up. It's a wonderful opportunity. It is ready. Money is not required. It's just an effort by every individual in this room.
Yeah.
Great example. I encourage everyone to have your cards in your individual capacity, in your organizational capacities. Please scale this up. India would be ready. Today we have only 4 crore cards there out of 140 crore population. Guys, think through.
Yep.
So thanks Rajesh for this question, and I think very interesting question, and I give a very simple example that we didn't try, but we sort of worked with an organization on that. And so today almost every state has a health insurance policy, almost every. Of course PMJ is the mother scheme, but before PMJ also there was most of the states had a health insurance policy. And we come from a cardiology driven company. It's a major portfolio for us. So the idea was, how do we link that lot of schemes of government? So you had something called, I'm sure people in the room would know, NPCDCS, right? National Program on Cardiovascular, Stroke and Hypertension. So a lot of screening was happening, and then after the screening, most of the time the people screened were left high and dry. That till yesterday I didn't have anything. Today after screening I know I have a high blood pressure, I have a high blood sugar, I have everything, but I don't know what to do. Right? So we said, how do we really tackle this problem? So you have screening happening here, you have tertiary care program happening through the insurance policy. There was a missing link in between, right? So we said, okay, people who got screened in such camps, and there are a lot of corporates who are doing screening today, through various organizations like PATH or Bill and Melinda Gates and so on and so forth. So we said, okay, let's pick up these people who have gone under the screening and who have now come out. Okay, out of those 5,000 people who were screened, these are the 200 people who are at the risk of kind of a cardiac disease because they have a high blood pressure, high blood sugar, their weight is high, they are alcoholic, they are smoking and so on and so forth. And then these 200 people then go to the secondary care, which is district hospital, and then they were done, say, very intense further screening, which is maybe ECG or a echo or something like that. And then we say, okay, these are the people out of 200, these are 100 people who need an intervention, medical intervention. So out of that, say 50 are on medical management, remaining 50 needs actually a surgical intervention. And then we connected these 50 people to the scheme and say, you get treated under the scheme either through a cardiothoracic surgery or an angioplasty. So the government schemes were utilized to just connect them through as a pilot, and nothing was spent basically, because government was supporting all the schemes. It was only a matter of connecting all the schemes together so that patient journey becomes smoother from screening to finding the treatment basically. So just a small example on how the small intervention through CSR can work to connect the available schemes and also provide the benefit to the patient. Thank you.
Thank you. So, your major target audience for the CSR is the state stakeholders, state government, because that's where back of the mind volume and profit is also equally important for you. Prabhat has worked with the CARE International before as a non-profit like us. Now it's a corporate. So how do you decide the agenda? Suppose the government has a problem, like 50% of country pregnant mothers are anemic. Anemia is very common. If you do the testing here also with some anemic. So how do you decide the agenda? Because state wants something else. CSR or the corporate has some agenda product specific. I can understand that also. So how do align? Because that's where the little bit of disconnect whenever we interact with the state government. CSR comes with their own agenda. So that's little bit of how do we remove this stigma. Yeah.
So I'll it's a very pertinent question. So there is one thing we call corporate social responsibility, right? If you remove social, there is a corporate responsibility, right? Whatever as a corporate we are doing. For example, I'll take example of a stroke care. Now, as you know, in our country, I don't know if you know, it's every 40 seconds, one person gets stroke. Every 40 seconds. And in every 4 minutes, one person loses life because of stroke. And even in our national program, NPCDCS, now it has NCD, one of the least talked diseases is stroke. And if you think in your family, I think we all have seen somebody jisko lakwa paralysis hota hai. And because it's such a time sensitive thing, you don't reach to a center on time within that golden hour. Now, this is a problem. This is a health problem, stroke, not talked much. Whereas government also want it. It's not that government do not want, but the whole issue is that it's a whole continuum of care, how you work on it. Years back, it was a business need for us, because when we wanted to do business in stroke care, if we have a drug which is used for thrombolyting patient when they are in hospital, we wanted these patients to get drug within those 4.5 hours. If patient doesn't reach, then we don't do business. While if you give this drug, you save one life. So it matches your objective and the society objective matches, right? Yeah. When we were doing as a business proposal, we were doing in few corporate private hospitals with a program called Angels. It was a program which used to streamline the process at hospital, and we used to award those hospitals with, but the whole process was that lot of capacity building from ambulatory staff, nursing staff, lot of coordination required within hospital. Stroke code is generated so that patient gets that service. Now, for last 2 years, we realized that this could be a program which has a potential to save many lives. So we scaled that program from being a commercial program to a kind of a corporate responsibility program. Now, as on date, almost more than 1,000 centers we have been working, and now from this year onwards, we have started partnering with state governments. We said that now we have piloted enough. We know this can work even at district hospital. Now let's move from tertiary hospital, medical college to district hospital, and make your district hospital stroke ready. Yep. Punjab and Haryana, almost 80% of the hospitals, they do stroke care. Now, many states are signing MOU, and we are saying that we will build your capacity to deliver stroke care. So, whether it's a non-profit or profit, I think for every non-profit there is a profit. Yeah. For every profit there is a non-profit thing. So, we need not to always, distinguish that only non-profit organization will do non-profit thing. No, there is a profit in everything. There is a non-profit in everything. So it matches beautifully when you have a nice mission and vision.
Thank you. So, some of the CSR, the major example, because they are most profitable, like Vedanta did larger collaborations with Ministry of WCD, and they announced 4,000 crore to modernize the Anganwadi, what they call as a Nandgar. So Sony is such a big international brand. I know you just started. Can it be possible, rather than thinking pilot, if there is a larger collaborations with Govt of India and working lakhs of health and wellness center, because most of the time you stuck with the pilot and ethical approval and it takes time to result. Why don't there is a larger alignment like Vedanta with the Govt of India level, and this diagnostic and screening tool be helpful for community at the bottom of pyramid and those kind. Is there any, can we visualize the future little bit of that kind of Sony and Govt of India?
Yeah, very well said, and that's I think the main agenda, or that AI should reach to the every person's corner, no matter geographically, or especially in India, for each and every village, because our mass population resides in the village, and there is still a disconnection with the doctors and the facilities that they carry. So that is really, I think, a big burning question, and situation is really required for that. And that, I think that for that slightly resources are required, and definitely yes, it's a bit early stage, but it's a very, I would say, the nice and the good thought that the AI or the AI-based solution should reach to the common man and the person, so that it can make more contribution towards the country's growth, especially for the healthcare and the wellness. And I think that's the basically purpose of AI also, that we just want to do an early diagnosis so that the patient can reach. I think abhi just बोला जैसे कि stroke के time में patients नहीं पहुंच पाते हैं directly, and that's why sometimes even they don't know कि what happened to them or where should we go, or maybe there's a one insurance policy, one is the like where should go the doctors, and the reachability when people don't know कि मेरे को ये disease है तो किस doctor के पास जाना है. So I think that's the reason I think AI can be a good combination, especially for the Indian people, and where they don't know who's the right expert, because sometimes they keep on talking to their normal physician, and sometimes physician takes time to just diagnosis and just say okay आप बड़े hospital में जाइए, या फिर वो he refers to the next one. So I think AI can be the right platform, and it could reach it out to the right treatment. That's why I say that AI is going to help so that right treatment should be given to the right person at the right point of time, so that it could be a life-saving in terms of the time, money, efforts, and everything. And I think doctor can also take a preventive measurement as soon as possible. And I think that's the big agenda of the AI, I would say.
Thank you. So, and one of the problem, because all the CSR, profit or non-profit, they focus more on the supply side of intervention, because we are handling or targeting the NCD, which is very common nowadays, and the behavior change is a big problem. Like for us also, someone asks you, do physical activity. It's difficult to change the mindset. So, Dr. Karthik, because you have a lot of entrepreneurial mindset or startups, because we need to change the behavior of frontline workers also, because they are the sales agent. That's where exactly the behavior change happens. So, is there any future focus of CSR? Because behavior change is very important. Whatever you do, diagnostic, treatment, drugs, if the behavior change doesn't happen, so I think someone needs to think in that direction, how to create the sales cycle. Asha as a sales agent, like Hindustan Lever, we are listening, they have a very good sales agent at the front line.
So I'll give you a live example of, I'm moving now from corporate with Dr. Hiramat to creating the world's first free homograph bank. So we believe that anybody in the world who needs a heart transplant or anybody who needs a heart valve can get it for free. And this comes back to the point, organ donation is a very sensitive thing.
Yeah.
How do you sensitize people? For example, if you do eye donation or any other organ donation, which is, eye is visible. So when you take eyes off a person who's expired, there is a psychological stigma associated for the family. Now, when you talk about the heart, as Dr. Hiramat was talking about NCD, it's something which you do not see. So we are partnering with, the institute, the Indian Association of Cardiothoracic Surgeons, to kind of create a grassroots movement, right? And how do we do this? We partner with agents of change. For example, with first response, I would say NGOs. There is an NGO called as Alert We Care. So as doctor was saying, when somebody collapses because of a cardiac arrest or heart attack, how do you deal with that? There are multiple NGOs who are doing this. So we realized I'm giving you a live example now as I take over as the CEO of this, Center of Excellence for Homograph Bank in Bangalore. We realized we need to partner with these people because the biggest or the hardest part of change management is the change itself. And you'll have to manage the change only by creating a movement or creating an urgency, a sense of urgency around the need for doing this. Like some of the statistics which Dr. Hiramat was sharing, or for any of the causes which we want to create an impact, we need to sensitize the larger population. So one at a macro level, let's say at the Prime Minister's office where we are talking today, we are engaging with some of the leading business houses who are committing to investing thousands of crores. So one, it cannot just be top down, other it cannot just be bottom up, it has to be a combination, right? So it has to start even at the bottom, working with the NGOs, working with people who are making this change.
Yeah.
Thank you.
Thank you. So every hour, in our country, 15 to 19 children die because of pneumonia. And this is drug is available, amoxicillin, so many things. It's not new disease as such. But still, in our country, 21st century, 15 children in an hour. When we finish this session, you can imagine. And biggest challenge right now, everyone is working in silos. Even in the states, corporates, like we are discussing, within the corporate, there are various verticals, they don't know what they're doing. Maybe Dr. Vibhav, you can just throw the light where, how the integration, because we are in the platform economy, nowadays with the digital, it's easy who is doing what. Can there be integrated model or platform at the state level where competitors, corporates, they work together to address this common cause or social cause? Because that way, it's a win-win situation for a state, as a government, as well as corporate, as well as a non-profit. Is there any future some kind of platforms are required?
I think it's a very, very, very important area that you talked about, Doc. I was just giving an examples wherein the same set of people are screened multiple times because the corporate want to do the screening program in same area. And unfortunately, nobody said that, okay, it's already done, please don't do here, please do somewhere else, right? So I think it's and I have been talking about it to many states that we need a CSR registry. If it is not happening already, it should happen. The state must do it, that you must know what all CSR program are running in your state so that the interference and also the duplicacy can be avoided. Redundancy is at all-time high from a CSR perspective, honestly, right? Because CSR, corporate like me, like him, like others, we work with a development partner, right? And the challenge remains is that development partner should work with the state, that I'm working in your state and I'm doing this, do not replicate this. Yeah. I think that's where integration will come, because I don't mind Boehringer Ingelheim or a Medtronic or a Takeda come and talk to the same set of people and do the same project. It's a CSR one. You said that there is a commercial interest. I try to push that back, honestly, because when we talk about CSR, we are doing enough of commercial programs to drive our sales. We don't need a CSR program to drive our sales, honestly, right? So therefore, it is important that integration should happen, and it is happening already. I have actually worked with a couple of pharma companies in some of the CSR projects, and that is a need, but CSR registry is a must to avoid duplication, so that the same amount of money, time, effort and human resources can be put in somewhere else where it is needed the most.
Great.
Thank you.
Thank you.
It's a very important question because we generally discuss. We are not into execution mode. The government of India has the resources, they have the infrastructure, but they do not have a capability of execution, which corporate does have, fairly NGOs does have. My suggestion is this: organizations like IHW should come forward, create a platform when the ideas are not just discussed, ideas agreed that this is going to be executed. We commit in next IHW summit, we are going to present the best practice, what is happening at the ground. I think this is the space we are lagging. And if a neutral platform can be created where corporates comes together, pool it, and we demonstrate some good practices, that will be the starting point. Then I know India has a brain, we are super genius people, everybody, we can give hundreds of ideas together sitting in this platform or in the room. But how many are truly going to implement? That's a question mark. Second point, I think I want to defer to the previous question on behavior change. In pharma or healthcare, behavior change, I have seen 30 years not happening because we are not spending enough in consumer awareness. You have movies on Bollywood masalas, you have so many things, sports. Our corporates or NGOs creating great movies which connects to the audience. Are we having a strong brand ambassadors for that? We really need to spend that money. It may not pay you in short term, it will pay you in big long term. I think that's an area of space because you see kids are adapted to the technology today. They just see so useless videos nowadays. But can we create some very engaging videos, reels? You see so useless reels nowadays. But where are those awareness reels in a very creative way, engaging way? If you are boring, 1, 2, 3, nobody's going to hear. So I think that's another area which we all have to invest.
Thank you. So currently, India is the highest corporate to GDP ratio. You look at the GST and the tax and so many things. That means something is happening in a good way. So is there any questions that you want to ask to eminent panelists in terms of challenges that you are facing or any enabling ecosystem that you need at the state and national government level? Because without support from the government also, you can't scale. You can pilot, but scale is a little bit of you need to depend on the system side also. Anything that you want to ask, or then I can give one more round to what kind of enabling ecosystem or challenges they are facing so that audience will benefit. Yeah, so please give the mic. We have 10 minutes, 5 minutes? 5 minutes? Okay. Please, mic there, if possible. No. Yeah. Maybe run.
Please come forward. You can come forward.
Yes. Thank you. Thank you.
Hi, I'm Dr. Pooja. I'm presenting the Indian Spinal Injury Center. So my question is that...
Closer, mic closer, yeah.
My question is that, one thing is that companies are looking for where to fund CSR. So sometime, like I'm a research head over there. So we are looking for partners who can collaborate with us. So how to approach you people? That is another question. You fairly said that there should be some neutral partner should be there, but till that comes up, I know DBT has come up one center where they wanted all the CSR to register themselves and partner, but it's going very slowly.
Okay.
But if you have something clue to how to approach these CSRs directly, would they be interested, or they still need some other pathway to integrate?
Thank you so much. I will add the questions as a last round because we got the signal. So if we are meeting for next year for similar kind of a CSR award, what kind of change you want to seek in the next year from the organization point of view, and the partnership questions anyone can rapidly.
So to answer that very important question, I have worked 10 years in that shoe, where how to get money, right? See, there is no formula. The only thing nowadays with so much of digital content available, follow the companies who are investing in areas where you want to work, right? That is one of the areas, so that you know this company is let's say going for academia industry collaboration, funding these kind of projects, and also responsibility of some of you to shape that mind. Because unless, and that is most critical, I think many of you are awardees here, I think it's important, there are areas which are neglected. For example, evidence generation, research, innovation. I think it needs a push from organizations also to push companies that, these startups, these research also needs a CSR grant. Our CSR guideline has empowered us to invest in those areas, but still I think expenditure is less. So follow those companies who are investing, and good luck.
Please next. It's a rapid fire.
Sure. I think just one, ma'am, to answer your question, please reach out to us by email and we should be able to help you, honestly. I don't see a challenge there. Everybody, all corporate have some CSR money, and I'm sure, whatever you're doing, everybody like health, education, sanitation, these are very common themes that all of us work on, so we should be able to help. But point number 2 that you mentioned about what do you want to see the change, I'm sure it's a part of this year's agenda as well, but I think CSR project should be sustainable. If you are changing your project every year, आज मैं health करता हूँ, कल education करूँगा, फिर सफाई करूँगा, फिर खेती करूँगा, then it's a problem. Please invest your CSR fund sustainably into one area so that that area can be developed. Whether it's a geography, it's a theme, or whatever it is. Because I have, in my experience, I've literally seen, even if you do 2 years, 3 years, that's not enough in the same area. Because the moment you take away your support, it collapses. So you have to work with the local government bodies to ensure that they take up when you leave. I think sustainability to me is the keyword there. Thank you.
You want to appeal about Gandhinagar event so that they can come with the innovations?
Yeah, sure. So people who are innovators here, there is a India MedTech Expo happening in Gandhinagar on the sidelines of G20 Health Ministers meeting on 17th, 18th and 19th of August. There are R&D and innovation pavilions, startup pavilions also. So if you have innovations with you in healthcare, you are most welcome. I can leave my contact with Kamal here, and you can check with Kamal and ISW Council. Thank you so much. Thank you for that.
Please.
Yeah, thanks. I think maybe 2 additional points. One, build your own credentials. Companies will not partner with you. We have a lot of, you think twice before partnering. It's a law of the land. There are risks around this. You have to adhere as a board of directors. You have to see the money is effectively utilized. So you need to build your credentials, speak on those, companies will reach to you. One is that you reach to them, but just don't reach when you need money. Share your best practices. Building on sustainability, I think what change I feel, as I said in the initial, can pharma companies, healthcare companies commit to invest their CSR only in healthcare?
Yeah.
I think that's the first primary response. I've seen many pharma healthcares either given to Prime Minister Relief Fund directly, easiest way. I'm adhering to the law of the land. Last day of the year, I give money. Straight, one check goes there. I'm adhering. Can ISW, can other organizations can really push positively? Can we guys commit together for a sustainable models? I think that's the key from my side.
Yeah, great. Thank you. Please, Dr. Sachin.
Yeah.
Quickly.
Good. It was a good question because sometimes it happens that partnership or a proposal does not get accepted by the corporate. So very well, I think my friends already added, but I will just add the more keywords and some keywords already discussed that be very clear in your proposal or the project. And in my definition, I say that be the very clear problem statement and the method. And as my friends was talking about, sometimes the project duplicacy goes place. So that's why the company doesn't want, like somebody just come to me and say, I just want to do a cardiovascular project, which may not be quite appealing. I would just suggest even there's some delta difference, please highlight that one so that company should be able to, I would say, approve it out. And we were just talking about the project should not die within 6 months or 1 year. So we should have some visibility, we should have some acceptability, I would say. And definitely companies understand like within 6 months or 1 year, like this team cannot complete the whole project. So you have to show the vision or you have to show the timeline that 6 months, maybe 6 years, 5 years, does not matter. But be very clear so that companies should know the life cycle of the project, what's the benefit. Even I would say, if your project does not qualify for 10 benefits, but at least identify one, which should be quite novel from the others, so that once somebody reviews your application, you should be definitely qualifying in a competitive environment. So that is, I think, the key factor even when I also evaluate across the India.
Please.
So I'll have the last word of the rapid fire, so it will be really rapid. And I'll say it in one word, if you can open source, if we can learn from Ubuntu methods, right? Doctor spoke about the Sri Sathya Sai Institute, which is offering totally free health services. The Homograph Bank, which we are trying to create, which is going to be the world's first free heart transplant. You need a little bit of devil advocacy, you need to benchmark, and there are plenty of academic institutes, including the IITs, which we heard of, who are willing to support you. So find your supporters, go for the open source model, benchmark and learn from others. That will be my
Thank you so
Thank
much.
you.
So big round of applause for our panelists. They are not only the panelist and speaker, they are ready to support or lend a hand. They are active on the LinkedIn. If you need any support from them, please. So Madam Bedi is here, so we have to stop. So we are at time up. So thank you so much. Really appreciate your time.
Thank you.
And look forward. Yeah.